I want to start with a story, and this story is about a boy named Michael. And Michael lived in a place called Arizona. And it was the 1970s. And Michael was very close with his grandma. Did things with her, he played with her, and he had a special bond with her. And so he was devastated when he was told that she would have to go into the hospital. But he knew that would probably happen again because she had been in the hospital so many times before. She had heart disease and had undergone bypass procedures. And now she was wheelchair bound. And on that day when she got discharged from the hospital, the doctor said they could do nothing more for her. They had no other options, and she would have to go home to die. And Michael and his family were devastated. And this happens quite frequently. Michael's grandmother was 65 at the time. This is Hippocrates, the father of medicine. And if Hippocrates would have heard this story about Michael, he might have said, wait a second, you're in the modern world. Why are people dying? Why aren't they more healthy? With all your technology, why don't you have a solution for this? Because Hippocrates said the best medicine of all is teaching people how not to need it. And then Hippocrates would look around and said, well, I know why now, because you forgot about what I told you. To avoid medicine, teaching people how to avoid medicine to be healthy. And so now Hippocrates would understand why Michael's grandmother would be sent home to die. So this is a map of the United States of our hypertension. This is actually the most current published data. 1 in 3 adults is diagnosed with hypertension in our country. And then you can see our part of the country predominates. And we are not only a good football conference, but we're also the stroke belt. Diabetes also quite prevalent in the Southeast, and 13% estimated, or 13.4% estimated in South Carolina. In the 1980s, the estimated prevalence of diabetes in the country was about 5%. Currently, it's around 10%, but that can be as high as 15% among African Americans and Hispanics. 13% in our country, or in our state, rather. Okay, well, I have blank slides. Okay, so with the slides that are not there, but what they did show is this, that the obesity rates in our country continue to increase as well. Diabetes and obesity are interrelated with one another. We're talking about type 2 diabetes. Now, type 1 diabetes that people are born with, where you are insulin requiring. We're talking about inherited diabetes that is interrelated with obesity. Obesity and type 2 diabetes are like chips and salsa. They're like beans and rice. And if you watch the Super Bowl, like Jennifer Lopez and Ben Affleck back together. So obesity and type 2 diabetes interrelated with one another. And with the slides that mysteriously disappeared, what you would have seen is that increasingly we have become more obese in this country. And if you look back to 1991, prevalence of diabetes in the country was less than 20%. Some states have diabetes prevalence of greater than 35 to 40%. And this increasingly is what we're seeing in the country. Projections for 2030, 50% of United States adults will be obese. And by 2050, 30% will be diagnosed with diabetes. And we look back to 1980, the 1980s, 5%, currently anywhere from 10 to 15%, and by 2050, up to 30%. Again, diabetes and hypertension interrelated with one another. Diabetes rates higher among African Americans and Hispanics. By 2030, the map may look something like that if we continue on the current path. So this is the most common cause of death in our country. The majority of premature deaths are preventable by the choices we make. 1 in 4 deaths, 25% are related directly to heart disease. This is a cardiac catheterization map. You can be diagnosed with heart disease here. You can receive a life-saving stent. It's awe-inspiring what medical technology can do today. But unfortunately, we have evolved into a passive reliance on pills and procedures. And as the map tells us, we are less healthy because of it. The faucet drain is shut, the water is on, the water is spilling over, and our current solution is to mop up the water, when the more logical solution would be to shut off the faucet, to turn off the water. Lifestyle medicine is really nothing other than what we already know. It's prove, promote, and preserve. To prove with evidence-based, which lifestyle medicine has been able to do, to prove with evidence-based that how we live and how we make choices can actually help us become healthier. To promote, to share with others, because we follow what other people do. We follow what our friends do. We are affected by our surroundings. And the most difficult to preserve. Sustainability is the most difficult of all of it. Because there's nothing easy with doing it. It's a constant struggle because of the stressors and all the surroundings that we have. The core principles of lifestyle medicine are nutrition, exercise, stress management, substance abuse, sleep, and relationships. So walking the talk is not easy, but what we want to encourage is to aim. Because when you aim for something, sometimes you miss the mark, but oftentimes you're right on target. And I like this slide a lot because what it does, it gives me hope. Because this slide says that we can change cultural norms. We can change the way we do things. Because not long ago, doctors were being used to promote something that literally kills us. Cancer, heart disease, COPD. This is what evidence-based medicine tells us. If we stop smoking, we can decrease our risk of heart disease by 50%. If we maintain an ideal body weight, a basic metabolic index of around 25, less than 30, we can decrease our risk of heart disease by 35 to 55%. And if we exercise moderate to intensively for at least 150 minutes a week, 2.5 hours, we can decrease our cardiovascular risk by 35 to 55%. In fact, there was a study that was done, a cohort study involving 7.5 million people, where we can reduce our risk of all-cause mortality, all things that cause us to die, by 20% by exercising at least 2.5 hours a week, moderate to intensive exercise. Studies also support this notion that if we exercise 2.5 hours a week, we can decrease our risk of breast cancer and colon cancer by 20 to 30%. 5 or more servings of fruit and vegetables per day, decreasing heart disease risk. And all these things get better too, because hypertension and diabetes and hyperlipidemia, high cholesterol, all these things are interrelated to causing premature death. So what do we avoid? Well, the highest consumption of refined sugars in our country are sugar-laden beverages, soda, energy drinks, excessive cheese, the ingredient, the largest consumption, the choice of Americans for saturated fat intake, processed meats, hot dogs, jerky, sausage, bacon. I know people love the bacon, but it's not good for you. In fact, it's not so good for you. It's on the list of potential carcinogens. It's up there with tobacco, radiation, and processed meats. The 80-20 rule: you can not outswim, outrun, outbike, outjog, outjump a bad diet. So 80% of what involves weight loss is our diet. 20% is our cardiovascular exercise. So what is a serving? People say, well, you should have at least 5 servings a day of fruits and vegetables. So this is what a serving is. 10 cherries, 10 grapes, 1 banana, 16 blueberries. So that gives you an idea of what, something concretely to aim for. A serving size, well, what's that? I'm a simple guy. I like to have 8 ounces of V8. Some people don't like it. If you don't like it, you can hit your nose and shove it down the hatch, and then you never knew what happened. And that gives you 2 servings. But if you want to have a half cup of cooked vegetables, that's good too. That gives you 1 serving. So 5 to 6 servings a day of fruits and vegetables is what we aim for. Sleep. So the majority of the country sleeps less than 7 hours, significantly less than we ever did. And the quality of our sleep has been negatively impacted by many things, technology among other things. We spend 1/3 of our life sleeping. And so being functional during the day is inherent and directly related to how much we're sleeping and how well we're sleeping. The top 3, what's that mean? Sometimes we hear about, in pop culture, being in the top 1% of the wealthiest of Americans. The top 1%, the elite. Well, the top 3% of healthiest Americans are those who are non-smokers, who maintain this healthy weight, who regularly exercise and consume the 5 fruits and vegetables per day. Because only 3% of the country can claim to adhere to all 3 or all 4 of those things. So these are the blue zones. The blue zones came out several years ago. They were derived by author Dan Buettner, and he collaborated with National Geographic and epidemiologists and medical researchers and anthropologists and journalists. And they wanted to seek out parts of the world where people were living to greater than 100, people living healthy lives to at least 100. Where was the greatest concentration of these people? And they brought out a map like this, and they circled those areas with a blue marker. And hence, they were called blue zones. Loma Linda, California, Nicoya, Costa Rica, Sardinia, Ikaria, Greece, and Okinawa, Japan. And what he developed in this National Geographic study and in several books since then are what characteristics did all of these places have that unified the ability to live to 100 or greater. And this is what they developed: to move naturally, a plant slant, purpose, the 80% rule. Wine at 5 has been changed to Friends at 5 because I guess everyone doesn't drink wine. So, but Wine at 5 was the original. To belong, loved ones first, and right tribe. So to move naturally. In Sardinia, they lived in this village, in a mountainous village. So there was a lot of walking up inclined plains. Moving naturally, gardening, doing housework, doing yard work. Going to gyms is great. You have a gym. It's fantastic. Doing work, cardiovascular exercise in a gym is fantastic, but not essential. Moving naturally. Walking, bike riding. The blue zones, regions, also were unified by this general diet consumption of green leafy vegetables and beans, all kinds of beans, lima beans and pinto beans and white beans and black beans and navy beans, fava beans. Pretty much any bean, with the exception of jelly, is going to be good for you. They had a purpose. These people had a purpose. Start with why. Simon Sinek's book characterized this notion of what drives us to wake up in the morning. Why do we exist? What is our motivation? Hara Hachibu was what came out of Okinawa, which is incidentally the only word in Japanese that I know. Except for konnichiwa. But the habits of Okinawa and the lessons from Okinawa were this: stopping at 80% full, listening to our brain, to cues while we eat, when our brain is telling us that we're 80% full, and stopping. Because stopping at 80% can be the difference between losing weight and gaining weight. And the lesson from Okinawa also is this: our largest meals should be at the front of the day, in the morning, and become less as the day progresses. Lighter meals, snacks in the afternoon and evening, and even fasting, because this puts our bodies into more of a dormant stage where we can have lipolysis, which is fat breakdown. Our insulin levels can go on sabbatical, and we can break down fat and lose weight. So wine at 5 or socializing at 5. And the whole point was getting together with friends on a weekly basis for a social. And the recommendation is that women not consume more than 1 drink each day, and that men not consume more than 2 alcoholic beverages in a day. And this is what a standard drink is. A purpose. So out of the 463 people that were studied in the blue zones, 458 of them belong to some faith community. And the study from the blue zones concluded that by attending some type of faith service at least 4 times a month was associated with an increasing life expectancy from anywhere from 4 to 14 years. Family first. So social connection, having the right tribe. I don't know that there's going to be a second date. They don't seem to be too into each other. There's been a lot of isolation since the pandemic. So social connection, imperative. Having a right tribe, someone with whom you can have a trusting relationship, a confidant, someone to vent to, someone who you trust. the right tribe. So shortfall nutrients, because diet is so important to all of this, are nutrients where at least 25% of the country are not consuming sufficient amounts. So 25% of the country are not consuming sufficient amounts of these so-called shortfall nutrients. Calcium. Okra and kale, incidentally, will give you more calcium than milk, simply because dairy products come in the form of calcium oxalate, so there's less absorption. Okra and kale have low oxalate, so more calcium is absorbed. The foods that I'm referring to in this and the next slides are foods that have high levels of these particular nutrients, at least 20% of the daily value recommended. Fiber, integral to decreasing risk of not only heart disease, but colon cancer. Magnesium. Brazil nuts also have high content of selenium, which decreases our risk of prostate cancer. Potassium. Now, this isn't an umbrella for everyone because some people have kidney disease, and so too much potassium is not good for them. Or they might be on a medication called an ACE inhibitor or an angiotensin II receptor blocker where people hold on to potassium. So this may not be the answer for everyone. But potassium is not only about bananas, baked potato, avocado. Avocado makes the list on a lot of things. So I'm kind of bummed that we banned avocados from Mexico. I hope that changes. Vitamin A, not all about carrots. Sweet potato, spinach, black-eyed peas. Vitamin C, not only about the orange juice, broccoli, cantaloupe, cauliflower, kale. Vitamin D. We can probably obtain all the vitamin D we need just by spending 30 minutes outdoors on a sunny day between 12 p.m. and 3 p.m. for about 30 minutes. So we make the vitamin D that we need. But if you need more, it comes in our diet as well. Vitamin E, vitamin K. And for someone who might be on Coumadin, that one would not be the right answer. So the right answer isn't the same for everyone, but shortfall nutrients are a thing that we need to consume more of in the country. Omega-3 foods. Inherent to many disease processes is this concept of inflammation, and we know that omega-3 foods are anti-inflammatory. Almonds and walnuts and cashews, seeds, greens, salmon, and all berries, high in omega-3. So the blue zones are also in our country. 56 communities, 10 states, affecting positively the lives of approximately 4 million Americans. And what the blue zones do in our country is communities collaborate. Hospitals, city governments, restaurants, grocery stores, schools, libraries, parks, they all come together to make healthier choices easier to make. And the teaching point is that good builds on good. We do what our neighbors do. We do what our friends do. If our friends smoke, we're going to be more likely to smoke. If our friends are vegetarians, we're more likely to go down that path. So if we're making easier choices and healthier choices in our community fosters that, we can overall become healthier. And the data has supported that. The obesity rates and the smoking rate and the cholesterol rates and all these markers that have been monitored in many of these blue zones have improved. So the almost perfect day, and I say almost because we can't control everything. Early bedtime, early rise, at least 7 to 8 hours of sleep. Start with water. The earth is 70% water. We are 60% water. So hydrating, and we haven't been hydrated all night because we've been sleeping. So hydrating with water. Quiet reflection, focusing on points of gratitude. What are we thankful for? What concrete goals do we have for the day? Maybe 1 or 2 goals. Exercising early if we are morning people. Not everyone is, but exercising early, you start the day right. Again, good builds on good. Aiming for 5 servings of fruit, starting early so that you're halfway there by lunch, and then you just keep going, getting closer to those 5 to 6 servings. Frequent breaks for those who do a lot of sitting. A study of over 200,000 people followed for 3 years, ages over the age of 45, showed that there was an increase in mortality, all-cause mortality, by 7% from just sitting too long. We were meant to move naturally. We were meant to move. We were meant to walk around. And even in those who exercise regularly, there was an increase in mortality from prolonged sitting. Larger meals in the morning, smaller meals in the afternoon. How do we have better sleep hygiene? 1/3 of our life is sleeping, so no alcohol or caffeine 3 hours before bedtime. Natural light exposure in the afternoon can suppress melatonin so that we are more alert, so we can be more efficient. Dimming lights 30 to 60 minutes before bedtime. Setting a time that we're going to sleep, dimming lights so that melatonin levels can increase. Blue light exposure from devices, whether it be a phone, a tablet, a television, an alarm clock, emit blue lights, which delay onset of sleep and delay potentially the quality of that sleep. Intentional connection with others. Studies support this notion that loneliness can decrease our life expectancy as much as smoking cigarettes. I think that's pretty profound. And actively pursuing positive experiences. Studies support this notion that if we can have an experience of at least 3-to-1 ratio of positive experiences and negative experiences, we can be more resilient to manage the daily stressors and adversity that we all face, that we can't oftentimes control. And who better to advocate positive experiences than the Magic Kingdom? A place where people are made to feel important. People's needs are anticipated. People are met with friendliness. And if someone at the Magic Kingdom happens to see a child crying, that's a negative experience. And that cast member knows that they're going to have to do some positive experience to outshine that one. In fact, at least 3-to-1. So they may go over and bring that child a balloon, Mickey ear ice cream, whatever, to make that child happier and their parents also happier. So what are your favorite things? How do we create more positive experiences? Doesn't have to be doorbells and sleigh bells and schnitzel with noodles, but you create your own positive experience, your own favorite things, learning something new, an act of selfless service, donating time or money to a cause that speaks to your heart, trying a new restaurant, traveling, watching a favorite movie, whatever. What are your favorite things? Actively pursuing things that create positivity. Because we become more resilient when we fill our day with more positivity versus negativity. So Michael's grandmother went home to die. And just at that time, Michael's family watched a segment on 60 Minutes, and they were advertising this place called the Longevity Institute in Santa Barbara. And it was founded by Nathan Pritikin, who was one of the founders, the pioneers of lifestyle medicine. And they enrolled Michael's grandmother into this intensive several-month program in-house where there was training, comprehensive plant-based food intake, exercise program, counseling, comprehensive support in restoring her back to health. And after several months, she was wheeled in and she walked out unassisted. And Michael became Dr. Michael Greger, who was one of the founders of the American College of Lifestyle Medicine in 2004. And it changed his life so much that he dedicated his life to this. She went in a wheelchair and came out unassisted. I will never forget that, were his words in his book, How Not to Die. Michael's mother died 31 years later at the age of 96, 31 years after she was supposed to die. This is El Cid, C-I-D, an 11th century Spanish warrior. And from El Cid, we derive some words: to kill, like homicide, but also the word to decide, to cut out, to kill things that are toxic or harmful, and embracing that which is positive and infuses excitement and energy. So lifestyle medicine is to prove, to promote, and preserve, but ultimately it's to decide, individually and collectively. Thank you. Do you have any questions?
In your practice, do you have a patient population that you follow and can assist holistically?
So you can practice it. I work in a hospital setting, and so my patients are inpatients that are admitted from the emergency department, many of whom have chronic illness. And so in my particular practice, difficult to do that, but certainly doable. But oftentimes we're treating acute problems, and it's not so much a preventive medicine. That's mostly for their outpatient physician. At least that's the intention.
So how do you see holistic medicine evolving to get the message out to prevent these chronic conditions based on those pillars of health to our community?
I think collectively we have to embrace it at the government level, at the insurance company level, and so people with influence and desire have to come together and feel that it is important and worth preserving, and worth promoting. So I think you just go along the course. I don't have the answer as far as the solution, but I believe that that's what needs to happen, that more people have to become involved and realize that it truly is important.
So with your practice, say you're a hospitalist.
Correct.
As a hospitalist, do you see yourself ever evolving into the practice where you have patients come to you to look to having lifestyle medicine?
Hopefully that can happen, because the whole point is to keep people out of the hospital.
Right, exactly.
Yeah, there are better places to be than inpatients in the hospital. Greger, Greger, and he was the Michael of the little boy. He became an adult eventually.
I just wanted to comment. I'm with an assisted living, and my passion has been with Alzheimer's for the last 25 years. And everything you said there is the same thing as what we're trying to promote to people who are afraid of Alzheimer's running. But it's just these basic principles that we're just not paying attention to. You know?
The answer is very simple. It's just do we value it enough, and have to get into habits, and it's much easier when it's easier to make those choices, and when other people around us are making those same choices.
I mean, I'm seeing more, probably since the COVID thing is starting to, that we're seeing more admissions, but I'm amazed at the people that are coming in and us. I've had 103 recently. She gives us all the age is just enough. Let me tell you, she's awesome. But the interesting fact is I'm seeing younger people in Alzheimer's, people my age, and I'm 66. And it's that generation now that's catching up with us in regards to health. I think that we would be these people in the world. I just think it's just interesting about people that from the old generation, the 90-year-olds, this is how they grew up eating good food and doing things, and then now had so much technology that have taken place of our
So technology has its obvious positive
and
things,
very
but
healthy thumbs.
that's true. That's true. Strong thumbs are helpful, and so positive things, but unfortunately, there's always a flip side that doesn't always work to our advantage. Dr. Lovell. Yes, and the thing that comes, so plenty of things to support a plant-based diet, and that's what all these blue zones were all essentially all plant-based. If they consumed any meat, it was rarely and on special occasions and maybe monthly. So plant-based, definitely, there's plenty of support well beyond the blue zones. But Game Changers speaks to me. Was a documentary on Netflix where there were, in fact, three different football players, one of whom was a vegetarian, two others that were big meat eaters. They consumed one ate a meat taco, the other one ate a bean burrito. They had their blood checked the following day, and the meat eater's blood was fatty, and the one who consumed the meat-based or the plant-based diet, his blood was clear, his serum was clear. Those same meat eaters consumed plant-based foods thereafter, and their blood cleared. So there's a definite correlation between what we eat and what accumulates within our blood vessels.
Great. And some of the folks systems, and they have similar Bernard is another capable helpful and plant-based diet. So, and it's a great video. It's easy to watch.
It is. Many of these same kind of pioneers of lifestyle medicine are featured in Forks Over Knives.
And we don't.
Is it going to be right now when you go to the grocery store, you see a lot of plant-based meat? Restaurants are advertising it. Is it going to be some a process with chemicals and stuff, or we just?
Well, hopefully not. I know that it's it's kind of the flavor of the moment as far as advertising goes. I think natural is always the way to go. You know, things were made naturally for a reason, and God didn't mess it up. We kind of have. So so that which is natural, I think, is always the right answer. So thank you for coming.
So you got one more? I was just going to mention that Dr. Michael site nutrition back lots of things.
Okay, well, thank you.
Thank you very much.
Thank you very much.
Okay.